and Top Doctors is joined by leading consultant clinical oncologist and breast cancer specialist, Dr. Aparna Jagannathan. Today, we're discussing complementary therapy for breast cancer. Good morning, Dr. Jagannathan.
Good morning, Caroline. Lovely to see you.
You too. Could you tell us more about yourself?
Yeah. Thank you for asking and inviting to give this talk. I'm very privileged, and I take this opportunity for everyone to get benefit from at the end of the video. So I'm a clinical oncology consultant. I qualified from India and came to this country 25 years ago. I got trained at Christie Hospital, the reputed cancer center. And I'm a consultant clinical oncologist at Royal Stoke University Hospital since 2011. My specialty is breast cancer and lung cancer. So I give chemotherapy, radiotherapy, I give targeted therapy, immunotherapy, both early stage and advanced breast cancer. And I've come across nearly 11 years as a consultant, all stages of cancer with all walks in their life. And recently I've introduced music therapy as a part of complementary therapy at the end of my consultation over the last few months. I myself is a musician, and I can see how it can help a patient fight the breast cancer or any cancer. So back to you.
Thank you. So let's get started with the questions. What complementary therapies are used as part of breast cancer treatment, or as maybe not necessarily as part of breast cancer treatment, but are suitable for people with breast cancer?
Well, it's a very good question. I was preparing for this talk, and to be honest, we don't talk about complementary therapy as a routine in our consultation. When the breast cancer patients come to an oncologist, it will be possibly for additional treatment after initial surgery. That's when their journey starts with the oncologist. So in my position, we have breast cancer nurse specialist that forms a team. So once we have talked about the conventional therapy, about the need for chemotherapy and the schedule and side effects on the radiotherapy bit, hormone treatment, depending upon what is involved as a conventional pathway, in the clinic, we don't talk about complementary therapy. So that is being dealt by the breast cancer nurse specialist who calls the patients out of the oncology appointments and give the support. These are all community-based, not hospital-based. Not all hospitals has a complementary therapy area or expertise to talk about it. They are available at the charities or the hospice or Macmillan Nurse centers, Mary Curie centers, but not within the hospital setup. But that's something I'm thinking that should be a part across all the cancer center to have a holistic approach, which is quite important to feel or make the journey quite comfortable in terms of complementary therapy. I think that needs to come up as an emerging additional treatment for all breast cancer patients. I hope that things change in years to come. So if you ask me what type of complementary therapies are given or offered, I have asked some of my colleagues, breast cancer nurse specialists and other nurse specialists, and I have looked at it, and only maybe 5 or 2% of patients ask directly the consultant can I do acupuncture? Can I do massage? Can I do Reiki? What do you think? And how the diet should be? How do I improve my lifestyle? So these are part of complementary therapy. These are the words that we hear as an oncologist in the clinic. And I do say, whilst on chemotherapy, avoid, because you are already tired. The side effects from chemotherapy, like risk of infection when the blood counts go down, risk of bruising. We do not know what is the status of the blood counts. We don't want any injury in the form of acupuncture or massage. You do not know how it's going to cause damage to the skin when you massage deeply. So don't do that invasive that affects the tissues. So don't go to that type of therapy, but you can always do other things like brisk walking, good healthy diet. There's nothing restriction about the diet, as long as you eat healthy, all the necessary proteins, vitamins, and minerals, hydrate yourself, and lots of mindfulness, yoga, just relax yourself, listen to lovely music, and don't carry the worry on your shoulder or in your mind, because all these things will indirectly affect the hormones, the stress hormones and the chemicals will surge in your bloodstream, and that will cause more metabolic abnormalities, the steroids, the cortisol, the stress hormones. If it goes up, the glucose balance is affected, and the lots of internal chemical balance and energy is affected. So that would reduce the immune, and that will not help you fight the cancer. So this is what I tell the patients with the breast cancer or any other cancers who come to me. Try to build up your immune system. So the natural way, that's what we call it as complementary. It's an additional treatment to the conventional treatment. So when we are all training, there is no syllabus for complementary therapy when we do our undergraduate, post-graduation training in medicine. To be honest, that's the thing. So there is little research or evidence based for that. Very little, if you come across. I don't think in UK it is regularized to be a part of having another organization for breast cancer treatment to be involved to advise and recommend this. So given the situation, from my own experience as a musician, I certainly acknowledge, and I think we should be talking about this to the patient. So we have been having leaflets through the breast cancer nurse specialist as to what we recommend during treatment. Once you finish treatment, I have asked, patients have asked me, what can I do? Can I do this? And I always support them. Now the treatment has finished, you're back to normal, your body has come back to normal self. I think I'm happy for you to go to acupuncture or massage or Reiki or mindfulness, yoga, brisk walking, all those things. I think the important scientific thing behind is when you do such complementary therapies that evokes the nature, that involves a part of the nature. For example, music therapy, you got the sound waves, the vibrations with a pattern that stimulates, go through your ears into the brain, that stimulates the happy hormones there. The endorphins is a happy hormone. It makes you feel better. So that in turn speaks to the other neurotransmitters, other nerve cells, which supplies other organs. And it gives you a sense of boost, a sense of happiness, a sense of relaxation. That in turn, talks to the immune cells that goes across the body, and that helps to fight the cancer or prevent the cancer, and it makes you healthy. All the tissues will breathe better, the blood vessel goes well, they all go with harmony with music and everything. So that's one type, that's how it happens. And or if you do aromatherapy, it goes through the smell, so that stimulates the brain. So it's a vicious circle, the same, the signaling pathway. And again, if you do the skin massage, or, if you do Reiki, touching certain energy spots, all these things are interlinked. It's so amazing. Oh my God, I wish, the nature, the super nature God, I don't know how scientific, he didn't qualify, but it's so amazing to see how the human body, the human tissues, are interlinked. Everything is atoms and molecules, and everything has its own energy releasing. Everything around us, the nature has energy releasing. The leaves, the trees, the smell, the air, it's contained, atoms. Everything is vibration, energy, vibration all around. So we have learned about your own human body, but we need to understand and acknowledge and appreciate what is around you, the air, the smell, the fragrance, the living trees, and everything, the vibrations, even the leaves, if you it sings, it has its own vibrations. The flowers, the smell it releases, it has its own vibrations. I think if you ask me advice to the breast cancer, being breast cancer or any cancer for that matter, please reach out for the nature around you, just stay in harmony with them, and then that itself is a complementary treatment, isn't it? Just remove the chaos, the chatter in your mind, and focus on the beauty and the nature around you. That helps you to fight the cancer. I have already told you the scientific evidence or the science behind the signaling pathway, how our human tissue and all the five senses, like, everything has acupuncture. You prick, you stimulate a nerve, you stimulate those things that goes up into the brain, and it releases the chemicals, the happy chemicals, and you feel good. So every spot you have, a human body is designed that the raw energy, it represents, the brain represents every outside or the body. If you massage the ear, something happens to the breathing and the circulation. So that's why we do a prick here, because it keeps stimulating all these things. So there is a reason behind why the culture, there is a reason why certain things are happening, like pricking itself is there is a science behind it. So hope that answers some of your questions.
Absolutely. No, absolutely. That's really, really interesting. And I really think it's important, to concentrate on how the science is what people need, but in ways that people can kind of find support for their mental health through complementary therapy is really interesting to find out. Thank you. So could you tell us about the therapy, the music therapy that you do?
Yeah, I play veena, which is an instrument, traditional South Indian instrument. It is available on the Top Doctors as one of the video, if you can go into it. So the vibrations, when you pluck the string, the vibrations it creates and all the scales, I discovered that if I play certain patterns, it gives me certain emotions. So, and I fuse the background music score with the rhythm. And if you fuse that, it evokes certain other, it enhances the sense of well-being, and it takes you totally into a different space, different realm, where your mind calms and it becomes your comfort zone. So I discovered that, and I thought I should share this. It makes you sleep better. It makes you to fall to sleep quickly, and you don't get bad dreams. Even you sleep peacefully. Nobody, so the system helps you give relaxation, total relaxation with the music. And especially I found out with a string instrument, there is no language, there's no barrier. So everybody can, appreciate and feel relaxed. And what I have done, taken that a step further to video, visual is also important, for people who can't hear, who can't speak, the visual is important. So it can reach all patient population, who has difficulty in hearing. So the visual effect of nature. So my video is always under the waterfalls because it's dynamic, it's rhythmic, it goes ups and downs. That is very inspiring. The trees and the leaves and the colors, that's very inspiring visual. So audio plus visual, that is a strong, most powerful influence on the brain to calm yourself down. And if you put it in a positive way, the colors that stimulates relaxation, the green and the orange and the yellow, they're all happy colors. It makes you bright. Yeah. So I have taken another step forward to bring those combination in my videos. And that video is one of the testimony from the patient, how she's fighting her cancer. Yeah. And that was really very much rewarding. And I'm trying to do, and I'm trying to tell everybody, listen with that way, whenever I tell patients, go home, just forget, you had cancer, but start to do a lifestyle where you can hear lovely music, do what you like, that is complementing your treatment to help to boost, depending you choose, whichever comforts you. Some patients are not comfortable with acupuncture. Some patients are not comfortable with certain things. So just choose, but I give them options. It is there, it is helping you. I want you to, open up for the complementary therapy as an option, not an option, as a recommendation, because not everybody thinks about this. Everybody is busy in their world. The worry overwhelming, the fear of, what's going to happen? Is it going to come again? And that's what's super on the top of the list, and that worry. And I started to tell my patients, No, that is totally wrong. Don't worry.
Yeah.
You know, just live and love and enjoy the nature. It doesn't matter advanced cancer, but live for the day, live for the fullest with the nature and enjoy. You will see the change. The next day, you'll be a different person. So that's my advice on the awareness for this month for the breast cancer. Complementary therapy, rightly asked. Thank you, Top Doctors team. It's the right question, appropriate and well recommended therapy from me. And thank you for giving me this opportunity.
Not a problem. And thank you very much too, Dr. Jane Nathan. It's been a pleasure. And to find out more about Dr. Jane Nathan and our expert oncology services, visit her profile at topdoctors.co.uk.
Thank you very much, Caroline.
No problem. Thank you.